views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, I'm George Bodarky. I'm the news director of NPR affiliate station WFUV, located on the Rose Hill campus of Fordham University in the Bronx. Each quarter, WFUV works to raise awareness of a particular issue through our Strike a Chord campaign. Past campaigns have focused on everything from emergency preparedness to healthy aging to children in foster care. We're very pleased to be teaming up with BronxNet for our latest campaign focused on emergency food services. Food banks throughout the country, including right here in New York City, have been seeing extraordinary demand due to the coronavirus pandemic. A lot of people have been laid off because of the outbreak and need help putting food on the table. So we've convened a panel of experts to give us a sense of how things are looking in the Bronx. With us is Christina Hanson. She's executive director of Part of the Solution, known to many simply as Tots. Hello, Christina.
Hello.
Judy Spitzer is Homelessness Prevention Department Director at Bronx Works. How do you, Julie?
I'm good. How are you?
Very well, thank you. And Judy Secon is Director of Operations at New York Common Pantry. Hello, Judy.
Hello.
So I want to just go around, if we will, and learn a little bit more about your organizations and the work you're doing to make sure people have food on the table. Christina, let's start with you. Tell us about Tots and the work you do there.
Sure. So Tots is a one-stop shop that has a very large historical connection to providing food to the community. We're located in the Bedford Park neighborhood of the Bronx, really close to Fordham University. And we have, traditionally we have a community dining room which serves hot meals and a food pantry where people can select by grocery, like it's a grocery store style. At this time, we've changed our services because of the requirements for public health for the pandemic, and we are still providing prepared meals at the door as well as groceries for our community. It's been extremely important that we've been able to stay open during this time and provide services safely because of the much increased need in our neighborhood. Both the zip codes surrounding Tots have been some of the hardest hit in New York City in terms of COVID cases, and then also in terms of job losses. Full 25% of working adults in the Bronx lost their job during this pandemic, and so the need has been huge. Since the beginning of the pandemic, we went from serving around 18,000 meals a week to serving close to, well over 50,000 meals a week. And that's been made possible by our amazing staff and service changes that we've done that mean that food distribution can happen faster, but also with the support of many donors in our community. But it really has been, every week it has been ramping up, and it's been both difficult to see the need and incredible to see how our staff has been great at responding to it.
Julie, talk to us about BronxWorks and the work that you're doing there.
Okay, so BronxWorks is a community-based organization. We're probably one of the largest community-based organizations in the Bronx. We have about 40 different sites. Most of our work had been concentrated around providing eviction prevention type work, shelters, immigration services, a multitude of services that we provide at BronxWorks. Our more recent services that we started providing is our pantry services. And our pantry services came about in, I believe, in 2017, where we were approached to start a pantry on one of our main sites on the Grand Concourse, because it was already thought to be a food desert. And even in 2017, we saw a great need for the pantry. We were getting overwhelmed with clients. Now that the pandemic started, our numbers have doubled. And we are a client choice pantry. And we started as a client choice pantry. And we kind of wanted to stay true to that model. And that's been a challenge. And I don't know if you want me to get into that right now. But
yeah, I do. What does that mean, client choice?
Well, client choice model is a model in which clients get to choose the items that they would like. Because what we find is that a lot of times when we do prepackaged meals, a lot of our clients have different dietary needs, and they just culturally, it's not what they're used to. So clients get to choose exactly what they would like from our pantry, rather than us prepackaging a bag for them. I think prior to the pandemic, a lot of pantries were trying to move towards that model, to offer to allow clients to pick what they want from our pantry.
Judy, talk to us about New York Common Pantry and the work that you do.
Yep. So New York Common Pantry is also a food pantry and a social service organization. And we also run a senior feeding program and a nutrition education program. So we have a pantry location in the Longwood section of the Bronx. We also have an East Harlem location for our pantry and our soup kitchen. And we run social services both out of our Bronx-based and our East Harlem locations. And then we do a senior feeding program, which is called Nourish. We serve 15,000 seniors a month through that program. And that is located, the main headquarters is in the Bronx, in the Mott Haven section. But we serve throughout the 4 boroughs of the city. So we're in Brooklyn, Queens, the Bronx, and Manhattan. And that probably was the program affected most dramatically by the pandemic because it was seniors, and we work with other senior sites. So we were unable, a lot of the sites closed. So we had to adapt that program fairly dramatically to keep serving seniors. And then also our nutrition education program, which is also located out of Mott Haven, worked in schools and worked in senior centers to provide nutrition education and do farm shares. So we've slowly been able to come back with the farm shares, but the nutrition education is now all digitally based. And we also are a client choice model. We're actually a digital client choice model. So people choose on a tablet. When they come in, they choose on a tablet so they can make their choices of grain. So it's white rice, brown rice, or the 5 food groups. So, but it is all digital choice. Or we were also doing online ordering. So people could order the night before and their bags would be pre-packed and they would come in and just pick them up. So it was service was quick and they didn't have to wait in long lines. And all of that did go away as part of the pandemic. We cannot do client choice anymore. We're serving everything from outside. We're doing pantry bags and grab and go meals from outside. We don't have anyone coming into our building. So, that's been quite a switch. And we have also, like Tots, we've partnered with a number of great organizations who have helped us to provide food and to provide services, and our staff we work to keep our staff very safe so we could keep doing services. So we put everyone on a staggered schedule as part of the pandemic response so that we could keep people healthy and apart from each other. So we've been able to keep serving, and in the Bronx, we've seen tremendous numbers as well. We're seeing something like 85% new intakes who are coming in.
85%.
Over last year, yeah. The new intakes is a huge amount.
I want to talk more about how your organization have been able to change how you operate to meet this demand and keep everyone safe. Your staff, the clients. Christina, talk to us more about that.
Yeah, so we, pretty rapidly had to make changes, in March when everything became clear that this was an issue here in New York City. It's been everything from making more hours for our staff that clean everything, to making sure that certain doors that people go through all the time maybe are propped open so people don't have to touch them over and over again, to having masks available for our staff very early on, and ensuring that only the people who absolutely have to be in the building are in the building, keeping distance and all of those types of things. So it's been just a complete rethinking of the way that we do our services, especially since one of the things that POTS has as a historical cultural thing is that we provide a lot of our services in person, all of our services, case management, legal. Our dining room is supposed to be a community gathering place where people come and eat together and get to know each other and create a community. And, it was a difficult mental process to go through. Oh no, we that community can exist. I remember for a couple of days at the beginning, we're like, well, maybe we could let the people who we know have a home take their food home, but we're going to try and keep the dining room open for those who have no home. And that just, it was obviously that was a nice idea, but even that couldn't happen. So it was just an issue of making sure we severely restricted the number of people in the building. We also scaled back a lot on our volunteers to make sure that, we weren't getting issues there. We have sick leave available for anyone who's even feeling remotely warm or sniffly. And just being clear with our staff about that, providing time for testing if that was something they needed. Our process for handing out to clients has become very hands-off. So people take a picture of an ID outside, that gets transmitted to the person who's dealing with the computer inside. The food is handed on a table and people then take it off of the table. So the interaction, people are able to stay distant. So we've been, with all of these changes, we've been very lucky. Our staff has stayed healthy throughout. And I think some of that is probably also luck. So I don't want to discount that. But.
With something so unprecedented, Christina, what prepares you for it? I mean, how do you say, hey, this is how we're going to do it when there's no blueprint for this is how we're going to do it?
Well, I think it's been pretty important for us to read what other people are doing. So there were a couple of, at the very beginning, we were doing a lot of work ensuring that we could connect with other homeless services providers or other food programs and see what their guidelines are and try and implement them. And just trying as much as possible to listen to places like the CDC. And then, I and other people on staff have a certain level of anxiety about these things. So using that anxiety for care, but I don't know if I think it's more just being flexible and being willing to make the change.
Julie, tell me more about the people that you assist at BronxWorks.
Our pantry is open to the public, and anyone can partake in our pantry. We've seen a big increase and a diverse population coming to our pantry that we didn't see before. Our population has significantly changed. We used to serve a lot of elderly people. Now we're serving a lot of younger people, people who are just now receiving pantry services for the first time. We've had to do a lot of changes to accommodate for social distancing, but we still try to provide the client choice. So with our model, as Helen said, we used to do it electronically and have people sign in and things like that. Now we switched the model so that way no one's actually touching anything that was touched previously by using paper that's disposable. I hate that because we're wasting paper, but it's safer. So people are handed, they're given an appointment to come in, and we have 10 people come in for an appointment at a time. So our pantry days are much longer because as we're giving appointments, as people, we're blessed to have a huge space to provide pantry services. So we are able to social distance. No one, including staff, are nowhere near each other. We stay at minimum 6 feet apart, if not more. So when clients come, we do hand them a menu of items. I lost you guys. We hand them a menu of items, and they're able to pick from that menu, and then they hand that menu back to us. Staff are all wearing protective gloves, masks. Even we ask clients, even on the outside line, to please use hand sanitizers. We marked every area that clients are 6 feet apart. And then when they give us the items, we, as I guess Helen also said, things are put on a table and passed over from 6 feet away. So it's been challenging. A lot of things have been challenging. I mean, we used to provide a lot of in-person social services on a day of pantry. Now that's been very difficult to do. We try to make appointments for people to come back to receive social services because we are trying to keep people out of the building as much as possible. And most of the social services now that we're providing to those in need are over the phone. In addition to our pantries, we are also providing people with gift cards so that they can get other items besides food that they need. Like people were coming in saying they need things like feminine hygiene products, things that they can't get. So we try to provide those, diapers, laundry detergent, soap, things like that. We ask for those type of things. And we encourage people to donate those type of things. One thing that I find is that people go through their pantries and they'll think, you can just give us this stuff, whatever's in their pantry box. That's not that simple for pantries that have been established, because we do have guidelines and regulations that we must follow, and we want to stay true to those things. And sometimes I worry, there's a lot of, although the need is great and the intent is great, there's a lot of pop-up pantries that are coming around and providing services, but I want to make sure that they're doing it in a safe way as well. When we first started, some of the challenges that we faced was people were scared. Yeah. A lot of the line staff were scared. They didn't want to come in. They didn't know how we were going to be able to do the social distance and making sure we kept people safe. But we were able to do that. We were able to get plexiglass and things like that. So that way, even when we were outside handing things out to clients, like the menus, it was done safely.
Early on in the pandemic, there was a lot of concern, and certainly real concern, because there was reality in it. And that's the fact that not everyone had enough masks. Was that ever an issue for you, that you didn't have enough PPE to operate effectively?
We saw that coming, and we actually, I remember that weekend right before the city shut down, and we knew what was coming. And we were, at that point, I think it was when there was a question, do you wear a mask, do you not wear a mask? And we decided, let's have everybody wear a mask. And we scrambled that whole weekend to call everybody, the ED, myself. We were just calling people, going to hardware stores, so we're like, we need to at least have enough. We have enough of this when people come in for the first week, and we'll just figure it out, but we can't mandate people wear masks and not have masks. So it was a big scramble to get masks. I actually sew masks. I was sewing masks for people and bringing them in. We were all whatever we could do. We had the gloves, because we always had gloves. We always have gloves, and we were stocked with gloves. We had ordered hand sanitizer in advance, and so we had enough. And of that, the wipes were tough to get. We ran out of those. They were hard. And then we had a lot of people help us with masks. So we got masks from people at Mount Sinai. We had a lot of groups come in. A local church group made masks for us, a local Boy Scout group. So we are good with masks at this point, and we do make sure every client that comes has a mask. And one of the other things that we've seen with the fear, when it first started, we saw our numbers go down. And despite the fact that everyone was saying that, the need for food, we knew that people were scared to come out. And so a lot of people were not actually coming out. And so we quickly partnered with a lot of other social service agencies who had their own client base who were food insecure. And I think to your point, Julie, about that they're not knowing how to handle food and handle it safely, they all wanted to do this, and they were like, we can get our people food. And then they realized quickly, no, we can't. We don't know how to order. We don't know what should go in a pantry bag. We don't know. And so we've been working, and we've given out, since we've started, about 80,000 meals that way through sort of a mobile pantry service that we didn't really have before.
I even had a distributor tell me that, we have some, not so good produce. And I'm like, what? No. And he goes, yeah, it's not that bad. It's just, it's still good. It might go bad in a couple of days, but I'm like, I don't want to distribute that. I'm like, no, that's, it has to meet standards as well. And I think, they say, well, the church accepts it. I'm like, yeah, but I'm not. Sorry. I think one of the biggest things when our numbers increased was that we were ordering a lot of food, and we were like, okay, do we have the proper storage? And then we were getting some donations of food. And then it's like, okay, we had to rush to go get refrigeration. We needed more refrigeration because more people are coming in. We need more shelving because more people are coming in. Unlike what I was saying, we did see a lot of our older clients that used to come to us stop coming, but then we got a whole bunch of new clients coming, people that I've never seen before. So that was the switch for us. It was the change was a lot of new people, a lot of younger people that were coming, some single people. It was different. And it continues to be different. Our numbers continue to increase week after week after week. Right now, our pantries really mostly operational on Saturday. We do have some other pantries for our seniors that providing that where we used to do senior centers at. Those are operating during the week, but our main pantry is on Saturday. And I think we're seeing so many people. Language barriers were a big issue. Thank God we were able to pull from our other components of our agency where we had people speaking different languages. So there's a lot of challenges with the pantry, but we're working it out.
Christina, have you seen many new faces? Have you seen a shift in the demographics that you typically see?
So our pantry has always tended to skew a little bit younger, just because our immediate neighborhood, if you were to look at the census demographics, it's just a little bit of a younger neighborhood. But we have seen a lot of new people who've never used Tots services before. And so it started to taper off a little bit in terms of the number of new. We're still serving a lot of people, but maybe they're people who aren't new anymore because they've already come to our pantry. But we went from seeing maybe 10 to 15 new people a day. Potts' Pantry is open 6 days a week. To seeing, we were at several points up in the 80s and 90s of the number of new people, regularly 40 to 60 new families on a daily basis. And every single new person who comes to Potts, we contact to do a phone intake. It used to be that they would talk to a case manager, but and so we're able to help them with other issues, especially since a lot of the new folks maybe hadn't had need for things like SNAP benefits or unemployment insurance or other types of connections with the public support systems before. They don't necessarily know how to do that, or they may have language barriers. And so our case managers have been able to work with those new people to help with other things, because while providing pantry is really important, it's only a piece of the puzzle, and it's to help someone through a difficult time. But some of these other benefits, the unemployment insurance, the SNAP, in some cases public assistance, is what they're going to need in order to really make ends meet over a longer period.
I know a lot of nonprofits are struggling right now financially. Governments, of course, are economically strained. Is there concern about funding for the work that you do right now for your organizations? Christina?
Certainly, there's been a really tremendous support for food services at the moment. We've found that that's been very positive, but there are areas where we see coming into the new fiscal year for the state and city government that there are things being cut. And so, just trying to figure out what those things are is the first step. There's so much uncertainty. And for now, they're just saying, well, we may or may not have the budget, but just keep doing what you're doing. We'll figure it out later. And of course, that, leaves us on the hook if they end up not funding those programs. So, so I think especially from the fact that the local and state government is going to be dealing with a huge revenue decline, it's really going to impact a lot of programs. And fortunately, we haven't really seen it yet because there has been tremendous support for the kinds of basic services that we provide to the community, but I can see it coming. And then also speaking with people who run things like children's programs and so on, ESL programs, a lot of those places are facing real threats to their business models.
Judy, do you have concerns?
Yeah, I have concerns. Currently, yes, things are good. We've been identified as one of the main issues, and so there's been a lot of support in terms of both food and funding. But the need for the food is going to keep going long after this is forgotten, and that's when I think we're going to get really doubly hit, because the funding won't be coming, but the people will be coming, and there will be more people and there'll be less funding. So we are concerned about the future. And also, there has been a lot of COVID specific funding, which has been really nice. But because of how we've been operating, sort of some of the other long-term things that you have in place, kind of, grant writing and applying for other sources of funds, really we haven't been able to do. And so that is going to set us in backwards a little bit behind when we sort of regroup after all of this and see what we need and where we're going.
Julie?
Yeah, I echo what my colleagues have said, that funding has been really, how can I put it, on edge, not knowing what the future holds. And even with the pantry, I would have to say, I differ with them, because without pantry, I think if it wasn't for private funding, we wouldn't be able to meet the demand that we're meeting right now. People always say, well, pantries run on volunteers and things like that. But in this day and age, it's been much more difficult to get the volunteers to be more consistent. So we do have to have a certain amount of staffing to do the ordering, it takes a lot to run a pantry. It's not just, the day of pantry where you're just handing out the food. It's the back end stuff and making sure that the menus are proper, like you have a proper amount of grains on your menu, you have a proper amount of protein and things like that, a well-balanced diet that people can choose from. And I'm hoping that the government understands it's not just about the food itself, which, some of them are providing, but it's about supporting the infrastructure of running the pantry. Those things are really important. And as far as, I'm really concerned, because for us, we understand that people often have to choose with paying their rent and making sure that they have things that to feed their families, provide stuff for their families. And if now that the moratorium is about to be lifted, I think we're going to get an influx of people scrambling, because every cent they have, they're going to need to pay back money if
Sure.
already doesn't put something in place. Because we haven't heard how, although they put a moratorium, how's all this back money going to be paid? How's all their back electrical bills are going to be paid? All those things, people are going to be in arrears with a lot of debt that once moratoriums are lifted and things supposedly go back to normal, how are they going to pay their back debt? People are very forgiving right now, but moving forward, I do understand landlords want to get paid, the electric company want to get paid, the bill collectors want to get paid. Food might end up being sacrificed. And a lot of our clients in our community, they have to have special diets. And we have a nutrition program that's encouraging people to buy more fresh fruits and vegetables and things like that, greens, not just, the whole bunch of carbohydrates and, things like that. People don't worry about. They look right now, they're going to just get a whole bunch of starchy food, something to fill their bellies, rather than looking at, I'm diabetic and I need to make sure that I'm buying food that's proper for my, to help me with my illness or whatever illnesses they may have, making sure that their meals are appropriate for them. And those are the things that we used to encourage. Okay, making sure you buy food that's appropriate for your health conditions. And those things might go out the window if somebody's not looking into how people are going to deal with their other issues. And that brings me back to the fact that our funding for our other social services are at risk, and those things all play a role.
Well, these are enormously challenging times, but I do want to end on a positive note, if I can. Judy, you referenced the community coming together, bringing masks, helping. Anyone else have a positive story of community pulling together what you've witnessed? I see, Julie, you're nodding your head. You want to share a story?
Yeah, I mean, it's the communities helping, not only the community, the clients, who are actually partaking in the services. They're rolling up their sleeves saying they want to help in any way they can. We've had donations, as I said before, donations are coming from the general public. Different organizations have called us and asked us, how can we help? How can we donate? They're making PPE equipment for us, masks and stuff like that. So we've had a lot of great donations come in. So
Great.
I want to say thank you to those who donated to BronxWorks.
Yes, thank you to everyone who's been doing their part, right? We've been hearing it throughout this pandemic. We're all in this together.
And I want to say one more thing. I want to say thank you to all the social service workers who are coming to work every day. I don't think people understand that, social service workers, we are putting ourselves at risk every day as well to them as well.
Julie, thank you so much for your time. Christina, thank you.
Yeah.
Judy, thank you.
Thank you.
That's all the time we have for this special edition of WFUV's Strike a Chord campaign in collaboration with BronxNet Television. If you want more information about WFUV's Strike a Chord campaign, go to WFUV.org/strikeachord. I'm George Bodarky. Thank you so much, everyone. Stay strong.